Hi everybody, Ziv Simon here. I'm the creator of Surgical Master. Welcome to this video. And in this one, I'm going to talk more about the free gingival graft, specifically the flap design for it. You've seen a few videos before. And it's such an important procedure, so common. And it also works extremely well. And you've seen a few videos before on the free gingival graft and how I mentor other doctors to perform this procedure. So the idea for this video came from Dr. Ahmed, I believe from Egypt, and he sent me a few photos of one of his patients. This particular one is a 23-year-old female with a middle class 2 recession on the lower incisors. Initially I thought there was a missing tooth, but just a huge diastema with a high frenum pull. And what Dr. Ahmed suggested was to do a frenectomy and deafen the sulcus. And then he was contemplating between a free gingival graft and a connective tissue graft. And this is such a common debate, discussion, sometimes even controversy. And doctors get confused. And by the way, there's no right or wrong. And very commonly, I can make an argument for each approach. But what I wanted to do in this video, I wanted to use this as a vehicle to talk about the challenges of the lower incisor region when it comes to soft tissue grafting and give you some ideas. So when you have this situation, you at least have a way of thinking. The easiest way for me is just show you the flap design and just make a short video. But as always, I always like to give you the tools. So when you run into similar situations, you have some knowledge, some more understanding on how to evaluate this area and then communicate the options to your patients. So basically, Dr. Ahmed is asking me what I recommend, what is my opinion. So first of all, before we talk about my opinion, let's look at the photos Dr. Ahmed sent me. And again, I urge you to take as many pictures as you can, use your digital SLR, use your phone, get these pictures on a screen and look at them detached from the patient. Look at them at your convenience and look at all the details. There's so much you can learn about this patient and so many even clinical decisions you can make just by looking at the photo. Not to say that the clinical exam is not important. It's extremely important. But looking at the photos objectively and making a list of these problems is going to help you tremendously. So that's what I'm doing right now. So this is the 23-year-old female patient, and we see that there is a lot of spacing, diastema, and perhaps an anterior open bite. It's hard to tell. Oral hygiene is not ideal. And on the left picture, we're seeing the main frenum, which is the center of attention, right in between the central incisors, right into the ridge. But if you look carefully, there is a lot more to it. There are several secondary freni in the tissue that have a very similar effect to the main frenum. Many times they go undetected, and many times they go untreated, although they're just as contributing to the problem as the main one. So I wanted you to pay attention to all the details, and all it takes is to mobilize the patient's lower lip and just see how those freni are connected from the mucosa into the attached gingiva and sometimes into the marginal gingiva, the gingival margin. We can also see gingival recession on the central incisors. Technically, it looks like it's Miller class 1 because the recession seems to extend coronal to the mucogingival junction, but perhaps in the angle of this photo, it's hard to tell. So Miller class 1 or class 2. We also see problems with tissue quality. The tissue seems to be very thin, and I'm taking this information from actually the lateral incisors. And we see tissue inflammation, redness, swelling, and all in all, an unhealthy situation. So what? What is the problem in this area? Before we talk about flap designs, before we talk about what to do and make a decision between a free gingival graft or a connective tissue graft, what's the big deal? If you don't know exactly why this is problematic, it'll be very hard for you to explain this to the patient. It'll be very hard for you to convey your rationale for treatment. So I'd like you to focus beyond the description of what's going on. I'd like you to understand what are the side effects of having this problem long term, especially for a young patient. It's all common sense and it's all simple, but you need to think about that. So this is a very young patient with poor oral hygiene, which obviously leads to gingival inflammation that in itself can lead to attachment loss. Now, the genetic contributing factor of poor tissue quality, these tissues are even more prone to inflammation. They're very loosely attached to bone and teeth, and they just get inflamed much faster. So we have two contributing factors to inflammation that can cause attachment loss. Now, if you add the mucosal pool through those main and secondary freni, that in itself is another contributing factor for inflammation because the tissue is constantly being pulled by the mucosa and it will not allow it to heal. Now, if there's mucosal pull on very thin tissue with poor tissue quality, all these factors will cause rapid attachment loss, constant inflammation, and all in all will lead to eventually bone loss, especially for a very young patient that has many, many years to live. We're looking at a liability, we're looking at a situation that needs to be treated. Now, I'd like you to understand these relationships because you can, in very simple terms, explain this to your patient and have them understand why they need treatment. So I hope this is very clear. So this is the end of part one. My voice is not great. I'm just recovering from a little cold. So I wanted to stop here, give you some food for thought, understand the problems, send me some emails, give me some comments about this video. I know you'll have some questions. In the next video, I'm going to talk about what are the options for this problem. And I'm going to talk about some of the reasoning for each option. This is a very problematic area to treat, and I wanted to point out the challenges that you will encounter in your practice. So if you found this video helpful, feel free to post it on social media, on your page. Feel free to share it with other dentists. Send me some comments and questions, and I look forward to seeing you in part 2.